Hey everyone, how's it going? My name is Patrick Liu, and I'm going to be your host for the Diabetes Survival Guide show. I'm the founder of the Diabetes Management Group, where I am a fitness and wellness coach for people with type 2 diabetes and prediabetes. And this show will be a way to share the phenomenal stories about people with all forms of diabetes, healthcare professionals who work with people with diabetes, health and wellness coaches who work with people in this population, and or caregivers and relatives with people with diabetes across the world. A little bit of a personal background for me as a show starter is I was diagnosed with prediabetes back in 2021 and made some modifications to my lifestyle and habits to successfully reverse it in 2022. However, that onset of me receiving prediabetes in 2021 triggered my memories of when my grandpa, who passed away when I was a sophomore in high school from kidney failure secondary to his type 2 diabetes, about the care that was misunderstood and not the greatest at that time. So I want to provide this show as a way to explore the different spectrums of diabetes and healthcare professionals sharing their tips of what they've seen helpful in working with folks with them, and then some things that weren't as helpful so that y'all can learn something. So thank you so much, and we'll get started with the disclaimers and the show.
Disclaimers. This show is not medical advice or a treatment plan and may contain sensitive and explicit content. It is intended for general education and demonstration purposes only. This content should not be used to self-diagnose or self-treat any health, medical, or physical conditions. Don't use this show to avoid going to your own healthcare professional or to replace the advice they give you. Consult with your healthcare provider before attempting anything you learned in this show. You agreed to identify and hold harmless the creators of this material for any and all losses, injury, or damages resulting from any and all claims that arise from your use or misuse of this show material. The creators and guests of this show make no representations about the accuracy or suitability of this content. Use these materials at your sole risk. Views and opinions are individual to the creators and guests of this show and do not represent any other opinions or entities and are not intended to offend anybody. We hope you enjoy the show.
Hey, how's it going, everyone? Welcome back to another episode of the Diabetes Survival Guide. I'm your host, Patrick, and I am a student physical therapist and a 180 system practitioner. I appreciate all the support that you've been showing so far with the past podcast episodes, and we're having plenty of people referring it out to their friends, increasing the amount of views that we have, and people joining our community. We really love sharing this awesome information with y'all so that you can improve your journey of living the best life that you can. And today I'm joined by a very special, very amazing guest. Miranda is a pelvic floor therapist, and she has done a phenomenal job in the Texas area by allowing her clients to not only feel empowered in being able to walk without having any leakage, but also having their confidence so that they can play with their kids for the mothers that are out there, so they are able to have the amazing memories with their kiddos, with their families, with their loved ones, and of course, something that is not talked about as often, being able to enjoy the pleasures of making love to their spouses. Because we all know that's a huge and vital proponent of relationships, and we are here to break down any boundaries, any stigmas, and I'm happy to have Miranda on here. So Miranda, feel free to introduce yourself and feel free to share how you decided to become a pelvic floor therapist and anything else that I have not covered yet.
Yeah, thank you so much for having me, Patrick. An honor to be here and talk to you and all your listeners. And so I'll start off by saying with my journey into being a pelvic floor PT started whenever I was an athlete in high school. Tore my ACL, so that was the path I set on, was working with other athletes. And then in PT school, I learned about pelvic floor women's health. And I was like, oh, this is interesting. I hadn't heard of this specialty before. And so it just set off that immediate interest in like women empowerment and helping women through these issues that are we're told are normal, you have to deal with, but we don't have to. So passion started there, and then just set forth on that after PT school, and especially after having my daughter. She's 3. I dealt with leakage and prolapse myself. And that just further made me realize, wow, I'm experiencing these issues, and especially prolapse itself. That can be something that can be really scary to be dealing with and make you lose confidence in yourself. And so, even for me, having those struggles with it, I felt that deeper connection to help other women through those challenges as well. So, that's where that really pushed me into really pursuing pelvic floor PT more, starting my own practice to better serve other women and moms in their path through pregnancy, postpartum, and then beyond, helping them realize just because we have babies doesn't mean we have to deal with these issues. And then just anyone in general too. Like I love younger generations because they can still have leakage, like gymnasts and younger ages hasn't had kids yet. They can still have pelvic floor issues. So there's a whole host of people out there who can have these issues. But that's where my passion started and where it's gone now. And a little bit about me personally. I have my 3-year-old daughter married to my high school sweetheart. We have 3 big dogs, so 3 fur babies. I love to be active. I love to be outside. I have a green thumb and love plants, and then just have that passion for helping moms. And then some of my experience in just coming right out of PT school and doing orthopedics, and then in pelvic floor in the 5+ years of being a PT, I have worked with people that have had diabetes and then have seen some common pelvic floor issues where maybe some nerve related issues cause maybe pelvic pain or leakage, and some of those issues that they maybe had, some people had diabetes, but also other factors that contributed to it, but other ones with diabetes that can exacerbate some of those issues as well.
Awesome. Thank you so much for sharing your story and journey and the awesome process of initially wanting to work with athletes and then learning more about the pelvic floor field and really setting it off, learning more about it, and then serving the community as well as sharing your experience of working with the diabetes community. I really love it. And for those who may not know, Miranda, would you mind explaining what prolapse means and educating us on that word and terminology?
Yeah, definitely. So prolapse is where one of the pelvic organs descends down through the vaginal canal. So that could be bladder, uterus, rectum. Sometimes the intestines can start to descend. So that's where prolapse can be a general term for different types, but more commonly see the bladder or uterine prolapse.
Yeah, thank you so much for sharing. And then for the guys who are listening to this, and also happen to guys. So,
Yes.
as someone, and I'll just share a little bit right now. Before we started this podcast episode, I just recently came back from my pelvic floor PT as well, because I'm experiencing some symptoms of pelvic floor dysfunction, which initially they thought it was overactive bladder syndrome for the past 2 years until I decided, hey, I think it's time for me to get a test conducted to figure out if this is actually overactive bladder or if this is something else. And it turns out it was pelvic floor dysfunction. And now I'm seeking out a physical therapist and physical therapist assistant who specialize in pelvic floor care to improve that work with that. And then for those who don't know, as Miranda talked about, people with diabetes, they tend to have more exacerbated symptoms of pelvic floor dysfunction or increases their risk of it because of how the metabolic disorder of diabetes, it affects how our muscles are able to metabolize those sugars and working effectively. And of course, the nerve components of all of it activating our muscles and doing it appropriately. Because of the diabetes, those signals aren't as good. So our pelvic floor is also considered muscles, and that's also affected as well. So for those who may be experiencing some of the hallmark signs of the overactive bladder syndromes of needing to go to the bathroom or waking up in the middle of the night, or constipation or diarrhea, or all those different things that are associated with it, this is why we have Miranda on the show, to educate us more about it and educating us through this process. So thank you so much for sharing that. And the next thing I want to cover, Miranda, is what are some common misconceptions or myths about our pelvic health? And then what are some of the same common misconceptions and myths for people with diabetes that you served with who've had pelvic floor concerns?
Yeah, so I'd say you already touched on one big one is that pelvic floor issues are only for women. I hear a lot of people or men be surprised that they have a pelvic floor too. So that's where you hear a lot of like pelvic floor physical therapy and like Kegels. And that's always thought of being like, oh, for women, right? But men have pelvic floors and they have issues with leakage and prolapse and pelvic pain and erectile dysfunction and all those different things that can be pelvic floor related. So I'd say that's a big one for sure. Another one is that this is just a natural part of having kids, which having kids could set you up for increased risk for having these issues. But where the myth is that after we have kids, I hear women all the time say, oh, I was told I'm just going to pee my pants the rest of my life, or I'm going to have to deal with pain with intercourse and just need to drink some wine or relax before. So there's those things where women are led to believe that they have to just deal with it the rest of their life. And even one as far as like age, like, oh, I'm old, I'm getting older. So this is just going to happen. So those are some common ones that I hear. And so there's a lot of things we can be doing now, preventative, to make sure these things don't happen and set us up better for later in life so that we don't have these incontinence issues as much. And the next part, so as far as misconceptions with people who have diabetes specific, that they're going to end up having these issues because of their condition, that, oh, if you're having this, that's because of the diabetes and you have to settle with that. So feeling like maybe they might feel like that just because of the diagnosis, they have to settle with certain things that they're told might be part of it, which that's not the case. There's help to help through many of these pelvic floor related symptoms, like you had touched on the overactive bladder, any bowel related issues, really anything that we've touched on so far could be pelvic floor related. So there's definitely help to help you ease up those symptoms and improve them so you don't have to deal with those anymore.
I love hearing your comments about that and debunking some of those myths, because many folks, they may not even know it's an issue or concern. And similar to people who receive their diagnosis with diabetes, and if they have type 2 or if they have type 2 diabetes, sometimes their doctor's like, here's your medications, I don't think you're going to reverse it. And it's like there's so much misinformation or outdated information that's out there. And I think it's awesome that you're able to say, hey, here's what's going on. We know way more about this because this is within our specialty and wheelhouse, and this is what we've seen. And then, of course, showing the results of it. So I really loved that you shared that and touched upon those points and really opening the minds of the audience who is listening to this, even myself too.
For sure. Yeah, that's one thing I love about just social media. Can be good and bad, but in that it's bringing more light to pelvic floor issues. So whereas people, if they go to their doctor and maybe before, like you had just said, or instances or cases I've heard where people just are told, oh, medication or do this, and they aren't given options or aren't led to pelvic floor PT, at least everybody they're having this knowledge of, oh, this is something that can maybe help me, and then they can look into it themselves and just educate themselves better, for sure, be their best advocate.
Totally agree. And for me, even though I'm a student physical therapist and I knew about pelvic floor therapy, it took me
Nice.
2 years before I was able to get to the point where we could get a test conducted in order for me to get the referral to even get into a pelvic floor therapist to have that covered.
Wow.
Be your own advocate. And for myself, the test that was required to be conducted for us guys out there, and probably for the women and everyone else that are out there, it required like a urodynamics test. This is going to get into some more specific details for folks, that it would involve having these electrodes to determine how active your muscles are. That'll be put on your pelvic floor muscles, and then they would use a catheter to go inside the urethra. So that's the part of your body that would pee, and then one up the rectum. So that's the one where the poop comes out. And in order to really assess, is it the bladder that's the issue? Is it the pelvic floor that's the issue? Is it something else that's the issue? And needless to say, very uncomfortable procedure. And this is why we got to be able to spread more awareness of this, so that maybe instead of having to conduct that test, we could just go immediately straight to a pelvic floor therapist without having to go through that stressful moment and time with that. Because the nurse I worked with, as I was going through that procedure, they're like, yeah, a lot of people don't even read the brochure of what that test entails. So they're very surprised when they end up doing that procedure. So yes, everyone, it's important to make sure you do your research, be your own best advocate, and of course, putting your foot down when you need to and when you want to as well, and explore the other options that are out there, because there's no such thing as a one size fits all option. And the best thing to do is to figure out what works best for you and learning as much as you can from other people who are specialists in certain types of care, because that one doctor's opinion is still just one opinion compared to other ones that are out there that may best serve you.
Definitely. 100% agree.
Yeah. And then I will also say too, the content that Miranda puts out on her social media page, like it's pretty helpful for guys as well. I will say some of the exercises and then learning more about the female and the girl's pelvic floor and pelvic health. Of course, that's going to really improve one's understanding of, oh, that makes sense of why my spouse is having these conditions. And if they were to already have kids, then the guys who are listening to this, if you know potentially a family member or knowing your spouse is having these symptoms, or even if you have your daughters that are out there, it's pretty important to know these things, and then just opening your awareness of, oh, it might be a good time to seek out a pelvic floor therapist.
For sure. Yeah, I love that. Even though my focus or niche might be more so like moms and women right now, still there's education within everything that I post that anybody can take something away from it. Just like you said, men and for their wives or ladies in their lives and daughters, there's education all around the board that can help everybody for sure.
Oh, yeah. I'm a huge advocate for all these things. That being said, I'm really excited to ask you this question, Miranda. What would you say has been your favorite moment that you've had since becoming a pelvic floor therapist?
Favorite moment? I think that would ultimately have to be late last year whenever I took the leap to start my own pelvic floor business because there's been I find joy and passion so much in helping these women. And whenever I first started, I actually saw some men, but helping them reach their goals and get rid of these issues that they're told at some point that they will not get rid of. So I love helping them overcome that. And that's just so rewarding for me. But ultimately, the most rewarding is whenever I took that step to not only for myself create a better environment, but more so for my clients that I see, be able to treat them how they deserve one on one, give them that quality time, and then give them these different opportunities with me to succeed that I couldn't have done anywhere else. So I feel like it allows me to serve in the way that I've always felt called to, but just in my other jobs, just didn't feel like I could and didn't feel like I was reaching my full potential. And now I feel like I am. So that's definitely the highlight for sure.
Ah, I love to hear it, especially that you're saying to yourself, I know I could do better in serving the people that I want to serve, serving those moms that are out there, serving the ladies that are out there. And it's time for me to make that full commitment for myself so that I could best provide for them. It always gets me chills and gets me excited to say, yes, we're rooting for you, Miranda. Keep on going. And I'm sure plenty of clients are going to be reaching out to you. So it's really awesome.
Yeah. Thank you so much, Patrick.
Yeah. All right. So the next thing I want to ask is, what was the biggest learning lessons that you've learned when treating patients? And this could be something that you may not think of right now, or something that may not come to mind immediately, but something that you feel has been a really profound aha moment, learning moment that would really benefit the listeners listening now.
I don't think there's one particular moment that I can think of right now off the top of my head.
Oh, share all of
But
them. No, I'm just kidding. 5 hours later.
But one kind of overarching theme that I've found is truly looking at the whole person that's in front of me, because I feel just coming out of PT school and just how things were segmented and broken up into body parts and taught look above and below the body part, but not like physically, right? Like looking at how their whole body is moving, because especially like pelvic floor, one thing people always think of with pelvic floor therapy, oh, gonna go over Kegels. And I'm like, no, like minimal to no Kegels involved. And so really it's a lot of looking at breathing, thoracic spine, even foot and ankle, what that is doing to affect the pelvis, but not only looking at the whole person physically, but also emotionally and their mindset. And that's something that I feel like was a big draw to starting my own business as well, because I saw, especially becoming a new mom, my identity got wrapped up in being a mom, that I lost sight of who I was. And that I feel like in a lot of the moms that I've worked with, they've dealt with that similar struggle and just a lot of overwhelm and things that go on in life, that I feel like understanding and helping to meet them where they're at there and supporting them as well creates this beautiful holistic picture to help them not only with physically and how their mindset about their physical body is, but also how, they are emotionally and how that's playing a part into everything. So that's really been the biggest takeaway, is just my learnings of that and considering the whole person and truly taking this holistic and full body approach with my clients, for sure.
That's awesome. I'm getting so many light bulbs are flaring up saying, oh my gosh, that's such a great point that you talked about being able to look at the whole person, because every time that we step, all of our muscles are activating. How does that affect our pelvic floor? And taking that holistic approach and giving them the quality of care that you are able to provide, and showing them that, hey, you are able to do what you want to do. You are able to understand how your body works, how it functions, but also the mental health component of, yes, once one becomes a mom, being able to understand that you're a mom in addition to being yourself, and
Mm.
remembering that there's still that identity within yourself, that you are this awesome, amazing person. And the mom is just another part of it. Not the mom is the taking the lead role and it's the only role. It's a part of you as a person, and all these other different factors that are within there. So that's really good, and I'm grateful that you shared that moment with us.
Of course. Yeah, it's been a big one for sure.
Everyone, thank you so much for tuning in to this podcast. And before we continue with the rest of this show, I wanted to let y'all know, please feel free to give this podcast a 5-star rating if you like it. Share it with other folks that you think it'd be beneficial for. And if you haven't already, feel free to subscribe and follow to the Diabetes Management Group for awesome tips to manage your type 2 diabetes or prediabetes. And let's get back to the show.
Yeah. The next thing I want to ask is, if you were to share one piece of advice with people who are considering seeking out a pelvic floor therapist, what would it be, and what can they expect for their first visit?
Yeah, so I'd say definitely see if you can get a couple options and then get a phone call, like a consultation call. I know a lot of therapists, especially if they have their own business, they offer those complimentary calls where you can not only get to know them and make sure you feel comfortable and can establish that rapport and relationship, because we talk about a lot of intimate personal things. And so you want to feel comfortable with that person. So some people don't always mesh well. So that's where that lets you get a feel for that right off the bat, but also lets you see with whatever you have going on, if you feel like they're the best fit for you, and hearing what they have to say and how they can support you, make sure you feel like y'all can work together to get you to where you want. So I'd probably say that's the biggest thing, is doing that research ahead of time, have those questions, ask them, and make sure you feel that connection with that person, because that can make all the difference in your progress.
Hmm. I loved hearing that. Really making sure that one is finding the right therapist for them, because having that comfortability, having that rapport is huge. Because for those who are considering it, as we mentioned earlier, it's going to be talking about a lot of intimate things and personal things that's going on in one's life. But the more one is able to share, that gives the therapist, the pelvic therapist, a lot more options of understanding, okay, what is the root cause of what's going on here? And it's a puzzle piece factor of trying to jigsaw all of them together. And by giving out more of that information and having that comfortable relationship where one is able to have that vulnerability to express themselves, and having that open arms of, okay, perfect, thanks for sharing that. Now let's work with what we have to further understand how we can improve what's going on and make it so that one's able to achieve the ability to spend time with their loved ones. They are able to enjoy getting back into the bedroom and having a great time there, having it pain-free, and being able to break down all the myths that came from their healthcare provider who isn't in tune with pelvic floor therapy that's out there. Because some of them are thinking pelvic floor therapy, as Miranda talked about, it's just Kegels. When in reality, it's no, not exactly. In fact, it's probably not even a Kegels issue. It's definitely some other issues that are going on. So I really love
That's
to hear that.
And that's really another point, just to build on what we've already discussed, is having that relationship, like we just mentioned, but also you'll get a feel for their treatment because every pelvic floor therapist has a different background. So, there might still be some that are very pelvic floor focused and don't look at the whole body. So that's where you can get a sense of their approach and if they will have that full body holistic approach. So then you can have an idea for their treatment style and if that will work for you or not.
hmm And also have questions, collaborate with
Mhm.
your pelvic floor therapist because I'm
Right.
currently doing that with mine and with the stuff that I'm learning as a 180 system provider of, oh, here's what I learned from my certification course for this. How can we apply this to what we're learning as well? Because the pelvic floor is still a muscle. And if we're doing the stuff that it's not quite helpful for the muscles because it's been outdated, it's collaborating with them and working with them and achieving that same and ultimate goal with each other and letting them know what your boundaries are. Like if you're not willing to do something, then feel free to voice that and feel free to share the reasons of why you don't enjoy it. Or if you just want to keep it blank statement, I don't feel comfortable talking about that right now. That's completely okay because they're there to work with you and it's going to be a relationship process of getting to know each other more and sharing as much as you can as you feel comfortable with because this is a very sensitive area and fortunately we're having a lot more people popping up and sharing their awesome stories and experiences and having the therapists that are out there to really educate others on this that they are able to build that comfortability, but of course at the end of the day do what is the most comfortable for yourself. Maybe challenge it just a little bit, but just know that we're all rooting for one success in the treatments that they'll receive and collaborating with their provider and really making sure that they're working together as a team versus the providers just telling them what to do. Because we want
Definitely.
your input too, because if we don't know what's going on, that's going to be a
Mhm.
struggle.
For sure. Yeah, that's where having that open communication, having that comfort level with your therapist where you feel comfortable sharing creates that dynamic where truly when you work together like that, where the therapist can help guide you, but then you also have that active role taking the lead, that it can create that better relationship to help you reach your goals even more.
Oh, music to my ears. All right. So, Miranda, thank you so much for sharing your thoughts on that. And we just have a couple more questions and we'll wrap things up. So, one of the questions that I ask for all the people who come on board, it's a fun one. It's what is your zombie apocalypse survival plan?
Oh goodness. I don't know if this was a ways off in the future. My husband's working his pilot's license, so I'd say that'd be awesome if he had that and we had our own plane and we could just fly to an island somewhere. But as far as like real like right now, I'd say if we didn't have that option, would probably to be like take over like a Shields. Do you have Shields where you're at the big sporting goods store?
I don't have that.
It's a huge sporting goods store. I'd say, I mean, take that over and have all the ammunition and stuff you need, food there. So yeah, I'd probably say that would have all the necessities plus stuff to fight against all the zombies.
Yeah, that's perfect. All right. And then what is one thing that you wish I would have asked you during this interview? And it could be something that you may not have thought of initially, but something that you feel like would be very beneficial for our audience members to know, and even for yourself to know too, for asking this question and really digging down to figure out, oh, that's an awesome question that I could share for people. And it would really help myself if I were in my past shoes going through this process.
I think one thing probably would that stands out the most is with the progress of pelvic floor issues and just knowing whether or not what's normal or not, what to look for. I'd say if you're feeling or noticing things like leakage, pain, anything like that. Or like one thing, like UTIs are something where people commonly mistake pelvic floor issues for UTIs. So that's where if you're going to your doctors and you're having these recurring issues and it's not getting better, there's likely something deeper root cause, likely pelvic floor. So if you have some of those inklings that we're going through the same cycle, something's not right, to check in with a pelvic floor therapist, because in most states you can go direct access and get started with them. And so just knowing some of those things that you might be experiencing, in like constipation, straining to go to the bathroom, that's not normal. Waking up at night to go pee, we shouldn't have to do that. Maybe once if needed, but otherwise shouldn't have to wake up at night to pee. And just as far as urination during the day, should be going every 2 to 4 hours. If you're going more frequently, then that could be increased urinary urgency and frequency. So all those kind of little tidbits of just some normal pelvic health type routines that we should be having. And like bowel movements can be anywhere from 3 a week to 3 a day. But as long as you're regular with the type, how it looks, all of that, it's likely more so you're normal. But just all those more normal pelvic health related things, and to notice like, oh, this is outside of that normal. So hopefully that gives a little bit of like a guideline for people on if they've been wondering if something is normal or not, helps them see what their normal kind of bowel and bladder habits should be. Because a lot of people don't realize that. I've heard people that go to the bathroom every 30 minutes or so, and they're like, thought that was normal. I have a small bladder. I'm like, no, you should be able to make it 2 to 4 hours. So things like that kind of helps to have an idea of what normal should be.
Awesome. Thank you so much for sharing that. And I'm sure the audience members who are listening to this, watching this, or tuning into it, I'm sure that they could feel the excitement and enthusiasm to know that, hey, there is an opportunity to improve the symptoms that I'm having with the constipation or the diarrhea or the urinary incontinence. And for those who aren't quite sure what a UTI is, Miranda, would you mind sharing what a UTI is?
So UTI is short for urinary tract infection. So sometimes that can give that burning, need to pee, going really frequently, sensation. And there's times where, of course, there is the infection going on, but the pelvic floor muscles, if there's tension or hypersensitivity, or the nervous system is oversensitized, that it can give those same symptoms. So that's where I'll see a lot of people keep going to the doctors and put on these different medications that then those are causing other issues, or really the root, or they're doing all these different tests where I'm like, no. So that's where back to being able to do the pelvic floor therapy first can help with some of these other issues and avoid those more costly tests and things down the road.
It's my years being able to figure out what the root cause is and going through there versus going through the hassle of the medication tag, because I've been doing it for 2 years and I do not recommend anybody go with that, because like I'd say for those who would be considering pelvic floor therapy, or those who aren't even considering it either, like first off, take a step back and imagine what would your life be like if one were to able to not have to go to the bathroom every 30 seconds, or what would one's life look like if they are able to go on those walks confidently without worry of any leakage that's going on. And of course, what would one's life look like when they are able to have a phenomenal time being able to focus on the things that they want to do, doing their job, or having fun with their family members for those reunions, gatherings, those outings, and everything along those lines to really improve their ability to live their life. And it's probably other factors too that one isn't even considering that can impact it by seeking out a pelvic floor therapist to really improve the symptoms that are going on, that can really improve their life and being able to live it freely, and how much time that it would save too. Because I'm sure if we add up all the minutes to hours being spent in the bathroom, having to run back and forth, doing it consistently and constantly, and then if one's on the road trip, like literally going to every single stop and exit to go in and out of it, and
Right.
compared to just going a straight 2 hours and they're able to do well, then taking a rest stop and then going another 2 hours. Imagine how awesome that would be to save all that time and being able to feel great about it too.
Definitely. Yep. There's hope to overcome those and not that be the normal for the rest of your life. So just thinking of what life could look like without that can be a big game changer for sure.
Yeah, and even thinking about the things that one even isn't even considering, like
Mhm.
the little things that are going on to even the biggest things, the biggest moments that are going on too. If
For
one's
sure.
wanting to start another family and going through about that, I'm sure a pelvic floor therapist can really assist with that process of being able to consult with that and going through with that. So very important.
And even with expecting and pregnancy, postpartum, all of that, not only the physical things, but some of the worry that can come with, oh, is this normal? And all of this, you can be looking at Google and all the things where just it can help to see a therapist that says, hey, this is what you need to know. This is what your body's doing. And just reassure you of where you're at too can make all the difference. So that preventive, like even before you're having issues during pregnancy, postpartum, or in life with whatever it is, it's still good to stay ahead of it. And it's you can go in for an assessment with a pelvic floor therapist, even though you don't have any issues. Just talk about
Mhm.
ways to prevent things for sure.
Yep. Even if for those people who have kiddos in their families and they're exhibiting those signs and symptoms, then definitely seek out a pelvic floor therapist because it's better to do it when they're younger and are able to understand how their body works down there versus having a lifelong issue that isn't resolved until so many years down the line that it could have been easily resolved by seeing a pelvic floor therapist for probably a few visits and probably a month, 2 months, or 3 months compared to dealing with the problems for 20 or 30 years, which, in my opinion, isn't that better just to invest the 3 months into a pelvic floor therapist to figure out what's going on and addressing it, or versus struggling for that 20 years that if we add up all that time would probably come down to 10 years of problems. Yeah.
Yeah, crazy to think about. And like you pointed out, one important thing is with education that everyone gets here, sharing that with or keeping an eye on your kiddos, making sure if they're in the bathroom a while or they're straining, make sure they know they shouldn't have to strain to poop. Because I feel like even me growing up, that was something I didn't realize wasn't normal. Like I thought you had to push some. So that's where just educating kiddos on what you're learning, helping to have that open communication with them so they develop these good bathroom habits too and prevent issues later on down the road.
And if people haven't already invested into one yet, definitely get a squatty potty. I posted that in one of my tips for the 100-day challenge, and that is a game changer.
For sure. Yep, gotta have a squatty potty. And they have the travel option now too, which I'm gonna get. Of course, if you have to use a trash can or something, when you're traveling, that works too. But they have a foldable one that's easy to travel with.
Oh, it's
There
perfect.
you go.
All right. Thank you so much, Miranda, for joining us today. It has been an absolute pleasure, and I'm sure our audience members have learned a lot. I know I learned a lot, of course, and it's always great to have that refresher as well. And how can people find you?
Yeah, thank you so much for having me on. And if anybody would love to learn more or follow me and see what I'm up to, can find me on Instagram at dr.miranda.dpt. So dr.miranda.dpt. My website is infiniteradiancewellness.com. And then I also have a Facebook group and a Facebook page. So if y'all would like to join my community where I'll share more in-depth tips and videos and things, and that's available too.
Definitely perfect for all populations, even if one isn't a mama, because I'm sure that there are guys that are out there that could at least take something out of it because that can also benefit their pelvic floor, or it at least educates them on how they're able to serve their female loved ones in their life or those with like their female counterparts.
Definitely. And I'm always happy if anyone has questions on finding specific therapists or if men have questions on where to go or what to do. I'm happy to answer those. So feel free to reach out to me if you'd like to.
Awesome. All right. Thank y'all so much for tuning in, and we'll see y'all next week for the next episode. And of course, take those small little habits and take those small little steps to improving your health, and amazing things is going to happen down the line. It's all about consistency, those small little efforts, and advocating for yourself. So thank you all so much for tuning in.